So I will be talking about hypertension, and this is a topic that I'm sure you've heard of. It's a very important risk factor within the field of cardiovascular disease that we manage, and it still remains one of the leading causes of most cardiovascular diseases that we take care of. And it's very important to understand what hypertension is and the management, medical, and also lifestyle management that you can do from your end to be able to better take care of your blood pressure if you have hypertension. And this lecture is actually inspired by a lot of the questions that my patients that I see in clinic who do have hypertension, and when I'm doing patient education, and also, when they also look up stuff on their own, a lot of these questions come up. So I figured, it might be a very important high yield topic to discuss with the community. So this is an outline of my presentation. So we're going to talk about the definition of hypertension, risk factors associated with hypertension, and symptoms of hypertension, what are the effects of hypertension, and then we'll go into the medical management, the lifestyle management, and then some additional tools and resources that could be very helpful to manage hypertension. And a lot of the recommendation in the definition discussion that we'll be having is based on the American Heart Association guideline. Which is a great resource for any of your questions regarding topics related to the heart, but also including hypertension. So definition of hypertension, bear with me, some of this may be, you may already know, but it's important to understand it because as I go into the lecture and explaining some of the effects of blood pressure, it's important to understand what these numbers are. So blood pressure measures basically the pressure when the heart beats, and it measures it when it beats, and it measures it when between heartbeats. And the top number is called systolic systolic blood pressure, and the bottom is the diastolic blood pressure. And systole is essentially when your heart is squeezing, and that's when your ventricles contract and they push blood out of the heart. So the red on the image, it's sending blood into the aorta, which then goes to the rest of your body to provide blood and oxygen. And then the blue is when it contracts your right ventricle, it sends blood into the lungs. And the period of time when the ventricles contract to push blood out of the heart, it's called systole. And that generates, as you can imagine, a higher pressure, which is the top number. And the bottom number is when the ventricles relax and allow blood to flow back into the heart. And that's called diastolic blood pressure. So that's important components of blood pressure measurement. And this is essentially explaining your systolic over diastolic. And which number is important? And this is one of the questions that I get asked a lot. Is it the top number or is it the bottom number? The answer is essentially, both of them are important. The top number is the one that a lot of people hear being emphasized, but I want to make sure that it's critical to also pay attention to the bottom number, because there are some patients who have pretty significantly elevated bottom number, which actually is associated with a lot of risk factors and cardiovascular comorbidities, which I will be going through over. So do not only pay attention to the top number, the bottom number is also very important. And a normal blood pressure is 120 over 80 is roughly the cutoff that we use for a normal blood pressure. And anything above that, as you can see here, the green is the normal. Anything less than 120 and less than 80 is considered normal. Elevated is between 120 to 129, and less than 80 is considered elevated. And Then we go into the stage 1, stage 2, and the critical hypertension. What is stage 1? That's after elevated, you have stage 1, which is 130 to 139 of the top number, or if you have 80 to 89. The or is important, and this is to signify that you do not pay only attention to the top or the bottom number. So it's either one of those if you meet criteria. Even if your blood pressure in the top one is in the elevated category, if the bottom one is still between 80 to 89, that's considered stage 1 hypertension. What about stage 2? Anything higher than 140 but lower than 180. So this is the wider category, and or if you have a diastolic blood pressure above 90. And hypertensive crisis, which we'll go into detail a little bit later. If you have anything higher than 180 or higher than 120, that diastolic being close to what a systolic blood pressure would be, that's a dangerous level, especially if you you start having symptoms. It's very important that you talk to your doctor immediately or go to the emergency room. So this is basically gives a rough the categories that we use when we're diagnosing patients with hypertension. And I would like to make a note. It's actually about a decade. It's been almost a decade now that the guidelines have changed, and there's been a lot of research that has been done in terms of what cutoff is normal, abnormal, because it used to be 140 used to be the formal definition of high blood pressure, but over the past decade, a lot of good research has come out that actually shows lower blood pressure is good, and that now that even blood pressure in the 130s is considered stage 1 hypertension. Okay, so what are the risk factors? We categorize them as non-modifiable and modifiable. So the things that we cannot modify, your family history, parents or family members, if you have especially first degree relatives, your parents having hypertension, that's considered a family history of high blood pressure. Age is a non-modifiable risk factor. As we age, our arteries harden and they lose that elastic nature that is a characteristic of our blood vessels. And when that happens, when we lose that elastic quality, whenever there is, let's say you eat a little too much salt and you retain a little more water, it doesn't accommodate the increase in blood volume, and that's why blood pressure ends up shooting up. And so that's one of the characteristics that comes with aging. Gender, until the age of 64, men are more likely to get high blood pressure than women are. And at age 65, women typically catch up. And this is a phenomenon not only understood in hypertension, but also in other cardiovascular diseases. Estrogen tends to be protective for women. And after, the average menopause happens around the age of 50, and in about a decade or so, we catch up. But when we catch up, we catch up quickly. So around age 65 is typically when women start presenting with heart disease, including hypertension. Black people tend to develop high blood pressure more than other people of other racial background. This is particularly in the United States, but this is also something that has been studied globally and other in the African continent as well. And it tends to be more severe, and some medications tend to not to work. So that's something that as physicians, we have to pay attention to when we are managing our patients. What about some of the modifiable risk factors for hypertension? So lack of physical activity, unhealthy diet, high sodium being the most culprit. As I mentioned earlier, with sodium, when you have sodium, as your body is trying to dilute the amount of sodium that you're eating, you tend to retain water. And that's why people end up swelling after a very salty dinner or salty snack. And that in turn increases your blood volume. And that spikes your blood pressure. So that's why we really emphasize when we counsel patients on dietary management of hypertension to really watch their daily salt intake. Being overweight or obese, too much alcohol, this is something that a lot of people are not aware of. And alcohol actually raises your blood pressure. And I have seen patients who, once I counseled them on reducing their alcohol consumption, I've been able to lower their blood pressure medications and even like stop some of their blood pressure medications. So this is, it's a risk factor that we need to pay attention to. Sleep apnea, that's another one that, and sometimes it could be very inconvenient. The treatment for sleep apnea is wearing a CPAP, and most patients, there are some patients who just cannot stand that, but uncontrolled sleep apnea actually increases your risk of high blood pressure, high cholesterol, diabetes, that, they usually sort of go together in the risk category of what we call metabolic syndrome with hypertension. Smoking and tobacco use, which has decreased in prevalence across the years, the decades since there's been a huge public education. Stress, that's the other one that I emphasize to my patients, because stress increases your cortisol level, your adrenaline level, and that could also in turn make your hypertension not controlled or lead to having high blood pressure. Just briefly going through what we call secondary hypertension, there are potential causes of secondary hypertension, and these are problems with the endocrine system, with the blood vessel and how it's formed. And sometimes, especially the one that we commonly see, especially in smokers and people who have other coronary artery disease or other atherosclerotic heart disease, is renal artery stenosis. And that is one of the things that we can, fix. But assuming, you don't have other risk factors, these are conditions that can potentially be reversible. And that's why the secondary hypertension name is used, as opposed to the primary hypertension, which is, outside of these reasons, you have elevated high blood pressure because you have these non-modifiable and modifiable risk factors. So, symptoms of hypertension. Some myths, or people with high blood pressure will experience symptoms like nervousness, sweating, difficulty sleeping, or facial flushing. The truth is, hypertension is called the silent killer, because a lot of times you actually don't have symptoms. It's asymptomatic, and it could be years and years before, if you don't go to the doctors regularly, if you don't get your blood pressure checked, you could develop high blood pressure, and it could be a decade, and then you start having some of the secondary effects of having high blood pressure. It could be developing plaque in your heart, it could be kidney disease, stroke, any kind of any of the effects that I will be going through before you start you get diagnosed. So that's why it gets the name the silent killer. So that is one of the myths that is important to that our patients understand, because you may not present with these classic symptoms. And these are just to go through them, because it is important to know some of this. If you do have symptoms, dizziness, irregular heartbeat, or pounding heartbeat, that's one of the classic symptoms that my patients communicate to me. Feeling nauseous, fainting, fatigue. These are very important symptoms to pay attention to, because especially if your blood pressure goes above 180, over 100 or 120, and you're experiencing these symptoms, this is considered a medical emergency, which would require quick attention by a healthcare provider. So what are some of the consequences of high blood pressure? So stroke is one of the classic ones that we hear about a lot. And that is because you could either burst a vessel because of the high blood pressure inside the brain. And that would be on the worst end of the spectrum. And that would be if you have a brain, that leads to a brain bleed. Or you could actually have a clogged artery because from having years and years of hypertension, and that clogged artery in the right context of having high blood pressure could break and cause a stroke. Vision loss, and that damaging the eye vessels. And again, chronic hypertension could lead to significant, and in addition to other risk factors like diabetes, could cause your eye vision to uh, deteriorate. Heart failure. That's when you really have very uncontrolled high blood pressure for a long period of time, that it actually causes a weakness in the heart muscle. And you present with heart failure symptoms, which would include, if you have shortness of breath, you start retaining fluids in your lungs, you start retaining fluids in your legs. And when we do imaging of the heart with an sonogram, we typically see a heart that's thick or that's dilated from years and years of kind of working against a very high pressure system. Heart attack is another presentation, and that could be because you have damages within the arteries of the heart, the coronary arteries, or it could be because, again, if you have symptoms like heart failure, that could also cause secondary damage to the heart muscle. And kidney disease is the other big one. With hypertension, the kidneys are integral to the management of your blood pressure. They are integral to the management of your salt control. So they're extremely sensitive to high blood pressure. And it's very important. And some of our patients present with kidney damage or kidney failure, the worst end of the spectrum. And sexual dysfunction is another thing that patients experience. So as far as how do we medically manage hypertension, which is one aspect of the hypertension management. So for normal blood pressure, we essentially make sure that we still communicate to our patients that they continue to do the heart healthy habits, balanced diet, getting regular exercise, checking their blood pressure regularly to make sure that they're, it's not creeping up. So it's just doing what you're supposed to do for your heart healthy lifestyle. If it's elevated, which is in the 120 to 120, 29 systolic and less than 80 millimeter mercury category, then you're at high risk of progressing hypertension. And a lot of my patients in this category, especially those patients who are young, who are in their 20s, who are in their 30s, in this category, I'm pretty adamant and aggressive in really communicating to them that you're showing signs of early elevated blood pressure. You're high risk of progressing to hypertension at a very young age, and that could be in their 40s, and sometimes even in their 30s. And I, make sure that I emphasize to them the importance of lifestyle management and really making sure that they're regularly checked at a doctor's visit, and then that they regularly check their high blood pressure as well. Because that's where prevention really will be making the largest impact. Once you progress to hypertension stage 1, and that's the 130 to 139 systolic and 80 to 89 diastolic range, again, these cutoffs have been changed over the past decade based on a lot of good new research that has been conducted in hypertension. And it used to be 140. Now we've lowered it to 130 to 139 because we are seeing, as patients are living longer, and in general, cardiovascular disease continues to be one of the highest leading cause of death in the United States. We're seeing that blood pressures, even within the 130s, are damaging to the organs that I mentioned. And that's why we are becoming more and more aggressive in managing high blood pressure at a very early stage. And this is when we consider adding blood pressure. I tend to start medication at this stage, especially if it's a younger patient. And we also take into account other risk factors, including diabetes, age is a risk factor, high cholesterol, family history. So all of those taken into account, we make a decision to start medication treatment. What about you get into the orange zone? That's high blood pressure stage 2. That's 140 or higher, or 90 or higher in the diastolic. And in this category, it is basically class 1 recommendation to start medication. And increasingly, what has been actually studied and understood is starting 2 agents when patients get into this stage, starting 1 or 2 medications at a lower dose is much more effective in controlling blood pressure than using just 1 agent. So essentially, we will start medication management. Obviously, lifestyle modification and counseling is always going to be part of the treatment plan. Hypertensive crisis. Obviously, if your blood pressure exceeds and it gets into the dangerous level of being 180 over 120, and you're experiencing those symptoms that I mentioned earlier, that's the dizziness, the chest pain, the shortness of breath, the vision loss or vision changes, you don't even wait to call your healthcare provider. You call the 911 and go to the emergency room. If you're able to access your provider, you'll probably be instructed to go to the emergency room so that you can be evaluated immediately. So that's very critical to know not to sit on a blood pressure that high with symptoms. And there are some patients who have uncontrolled hypertension and do have that kind of blood pressure, and they don't feel symptoms, and they're okay. And sometimes we see blood pressures like that in clinic, and we're okay if they don't have symptoms, just adjusting their medication, making them come in within a week or 2 to make sure that it's responding well to treatment. But if there are symptoms, it's a medical emergency, you go to the emergency room. And that's basically essentially what is also reflected on this slide. And as far as I think, measuring your blood pressure, a single high reading is not an immediate cause for alarm. You take a breath, and take your blood pressure a second time. And if you do continue, if you still have a very high one, you consult your healthcare provider immediately. If not, if it looks like it's coming down, you write it down and you can contact them later. Okay, I just want to show you this video because it's very important. So the next part that's the medical management. That's sort of our part. And there's the part that the patient has to engage with to be able to effectively manage hypertension. Let me see if I could. Oh, there, way to play. There. It's a short video from the American.
I think I'm gonna start cutting carbs. I need to drop my belly fat.
If you want to drop this,
Start eating more of these.
So skip
starving ourselves, eating salads and cutting out carbs.
Okay, let's have a real talk about blood pressure. Do you monitor yours regularly? It's something everyone with high blood pressure should do, but it's something most people don't know how to do correctly. Checking your blood pressure regularly will help let you know if you have it under control. It will also help you start to understand which factors are putting you at high risk for stroke and heart attack. Before I get to that though, I just want to stress one thing. If you have high blood pressure, you should talk to your doctor to figure out how frequently you should be checking it at home. For most people, taking your blood pressure twice in the morning and twice in the evening, even just for a week, will help you and your doctor get a better understanding of your blood pressure. For morning readings, it's best to take those before you take your blood pressure medication. It's also very important to avoid exercise, caffeine, or tobacco at least 30 minutes prior to testing, since those can affect your levels. Now, let's move on to talk about the proper way to measure your blood pressure at home. Nearly half adults in the US have high blood pressure and are at high risk for stroke and heart attack. So self-measuring is one of the easiest ways to be proactive about our health. Here I have my blood pressure monitoring device. It's easy to use and it helps me get an accurate reading. Be sure to get an automated device with the upper arm cuff. That's the type doctors recommend. The first thing you want to do is find a quiet place to sit where your back is in an upright, stable position. A dining room chair is great. You want to make sure the chair isn't too soft so your body is fully supported. Sit with your feet flat on the floor and don't cross your legs or ankles. If you need to use the bathroom, make sure you go before you do your reading. Next, rest your arm on a flat surface with your palm facing up. Place the blood pressure cuff on your bare upper arm just above your elbow. Your arm should be relaxed and resting so the cuff is at the same height as your heart. Now rest quietly for 5 minutes before taking the first measurement. Avoid talking while taking your blood pressure measurement. Once your first measurement is completed, write down the blood pressure numbers and pulse that are displayed on the device. Wait 1 minute and then repeat this process again. As you just saw, it's important to check your two measurements at around the same time each morning and evening. At your next doctor's visit, be sure to share your blood pressure numbers so you can discuss the numbers and so your care plan can be changed if necessary. That's it. Not bad, right? Measuring your blood pressure at home is easy to do and a great way to stay on top of your health. If you have more questions about managing or measuring your blood pressure overall, visit the website.
So this is
So
something.
Dr. Bahiru, so the people on Zoom didn't see the video, but as I
Oh,
put in the chat, it'll be in the recording
perfect.
and then the link will be in there as well so they can see it.
Excellent. Great. Okay. Okay, so that's actually something that I require from my patients. Whenever I see my patients with high blood pressure, I make sure that I communicate to them that because patients in a doctor's office usually are nervous. They're excited, and the blood pressure usually is high, and I don't like responding to just one time in office blood pressure reading, and getting that information from home, checking their blood pressure twice a day, even if, like the video mentioned, even a week or 2 weeks worth of data is tremendously helpful when we're deciding on how to dose patients. Because sometimes, they come to the office, they have high blood pressure, and then we overreact and increase their medications too much. And then they go, patients go home in their natural state. And then their blood pressure goes really low and experience symptoms of low blood pressure, and then it becomes harder to manage. So I like seeing the data from home data. So that's something that I require. And the one thing that I want to emphasize, what was mentioned in the video, is measuring your blood pressure before you take your medication in the morning. And that's very important because depending on what your doctor decides to do, whether they want to do morning or evening medication, and sometimes it may be a twice a day medication dosing, it's very helpful to get that number before you take your blood pressure because it reflects how good your control is. If you take your blood pressure after you take your medication, then we will see the effect of the blood pressure medication immediately after. But if you take it before, and let's say you took your medication the morning prior, and it's high, that tells me just giving you medication in the morning only may not be enough, and you may need twice a day medication to be able to be controlled 24 hours. And that's why it's critical and it's important to take your blood pressure blood pressure reading before you take your morning medication. So how do you choose a blood pressure cuff? Choosing a home blood pressure monitor, the American Heart Association actually has some recommends automatic cuff style bicep. We do not really like the wrist monitors because they're not as reliable. They tend to underestimate your blood pressure. So you may assume that you're well controlled, but when we check it in the office with bicep, cuff style, it tends to be elevated. So it's important to have the right kind of blood pressure machine at home. You can choose a monitor. This is a website that's recommended by the American Heart Association that you can easily use to find options. Omron, that's the picture that's is you see in on the slide, is one that I typically recommend. It's a fairly reliable one, and I that's one of the ones that I recommend to my patients. But you can choose other ones too that are perfectly fine. And make sure that the cuff fits. If it's too small or too big, that could falsely elevate or falsely make your blood pressure be too low. So it may not be accurate. So it's important to choose the right cuff size for you as well. So lifestyle management, this is something that is typically emphasized not just for high blood pressure, but anything related to cardiovascular health. And that's salt is one of the main basically enemies, and in terms of hypertension, and it's everywhere, and especially in the American diet. Eating enough potassium, potatoes, bananas have, because potassium actually works in your salt balance. It helps with the excretion of getting rid of sodium out of your body. So it's important to eat food with, a good amount of potassium in it. Eating a balanced diet, not smoking, limiting alcohol, physical activity, and making sure that you're managing your weight. So this is just to kind of give you an idea of this. A normal table salt is about 40% sodium chloride, and 1 teaspoon salt has 2,300 milligrams of sodium. And it just shows you how easy it is to get to your daily recommended dose. And it's especially if a lot of people think, oh, I don't add salt to my, and so this, which is my next topic, is I don't eat too much salt because I don't add salt to my food when I am cooking. And that is one of the most common responses that I get when I ask my patients, do you eat too much salt? And the follow-up question for us healthcare physicians would be, what kind of food are you eating? Because even if you're not adding too much salt to your cooking, most Americans get a bulk of their sodium, from snacks, from soups and cold cuts and cheese and bread. So if you're eating these foods, if it's a majority of your daily, or if it makes a good amount of your daily calorie source, you're still eating too much salt. And also don't forget, food without even adding salt naturally has sodium in it. So you're getting that sodium source as well. Cheese, poultry, is something, again, cheese has a lot of, from the natural non-processed foods, that has high sodium content, and also checking some over-the-counter supplements and over-the-counter medications that could have salt as well. That's another sodium source that may be sneaking into your diet that you're not aware of. And what is considered the healthy or hypertension diet is the DASH diet, and this is something that has been studied for decades. And DASH stands for Dietary Approach to Stop Hypertension. It's proven to be effective to lower your blood, sodium sources and also blood pressure. And potassium is one of the recommendations, which, helps with excretion of sodium. And it also helps ease with the tension in your blood vessels. So further lowers your blood pressure. So that's a good kind of electrolyte, not sodium, for your high blood pressure management. And you can find DASH recipes online. The American Heart Association has good resources on that. And this is a picture that I got from the NIH that basically has a good category of what to eat and what to limit in terms of, and there's a lot of crossover with any heart healthy diet that we recommend. Can I drink red wine as much as I want because it's heart healthy? This is another big question that we get. And the answer is no, not really. Because, a lot of the benefits of red wine it's becoming more and more that other confounding factors of just, patient level factors probably are the reason why the early studies have been positive in terms of the benefits of red wine, and moderation still remains to be key. And moderation means 2 glasses or less for men per day and 1 glass or less for women per day. So that is one of the also common questions that I get from my patients. What is moderate exercise is important, and what is considered moderate level exercise? That's 2.5 hours per week of moderate intensity, and physical activity, brisk walking. And this is one of the things that I highly recommend. As we age, we lose a lot of muscle mass, and incorporating muscle strengthening activity is very key. And that's one of the things that the American Heart Association also recommends. And how do you assess whether you're moderately intensity, physical activity for your level of fitness? Because there are some, patients who've been an athlete all their life, and brisk walking may not necessarily be a moderate intensity. So anything that sort of makes you feel short of breath when you're exchanging sentences, not necessarily forcing you to stop to breathe or take a break, but it's not too comfortable to have a lengthy conversation, that's considered a moderate level intensity exercise for you. And it's key to have that at least 3 times a week, a day, for 30 minutes is the minimum. And if you could do more, that's even great. Do I have to take my blood pressure medications for life? This is also another one that I get asked a lot. And the answer is, unfortunately, high blood pressure is one of those lifelong conditions. Depending on the reason for it, there are the secondary hypertensions that have a secondary cause, sometimes could be reversible. When we fix the main cause, they go away. But primary hypertension, typically patients have to be on blood pressure medications in addition to lifestyle modifications. But that doesn't mean that we cannot reduce the amount of medication that you are on with the lifestyle medication changes that are made. I have patients that with weight loss, I take them off 2-3 medications, and they're on 3-4 medications, and they're only on 1. And so it is definitely a possibility to reduce the amount of medication that you're taking. But generally with high blood pressure, it's typically patients have to manage it lifelong. What are the typical classes of blood pressure medications? These may sound familiar. The diuretics, they're one of the first lines, like hydrochlorothiazide, diazide, the beta blockers, metoprolol, atenolol. These are not usually first line, second line medications. ACE inhibitors like lisinopril, ramipril, the angiotensin II receptor blockers, olmesartan, losartan, they work on the kidneys. The calcium channel blockers like amlodipine, alpha blockers, prazosin, doxazosin. And then clonidine is one of them. That one is usually being phased out because it causes a lot of labile changes in blood pressure. And then, some of the vasodilators and combined alpha and beta blockers. And this is an excellent resource and toolkits available through the American Heart Association that can be used to, to get additional recommendations on lifestyle modifications, and actually even files that you can use to monitor your blood pressure, record it, take it to your blood pressure, questions to ask and engage with your healthcare provider. So a lot of resources that give patients important knowledge and autonomy to manage their high blood pressure. So low blood pressure, how low is too low for blood pressure? This is one of the other questions that I get. Lower blood pressure is generally very good for your heart. And there is a big study that was done several years ago, within the last 10 years. It's called the SPRINT trial. And based on that, it's been shown that low blood pressure, including for all age groups, and that's including for patients above the age of 75, is associated with significant reduction in cardiovascular events. And that's heart attack, stroke, kidney disease. And that's one of the reasons why even the recommendations, the guidelines have shifted significantly. And now we're emphasizing good blood pressure control, targeting blood pressure 120 over 80 is, what we aim for our patients. The definition of hypotension is if you have a blood pressure 90 over 60, but generally what I tell my patients, if you have, blood pressure lower than 120, let's say in the 100s, bordering in the 90s, and you're feeling lightheaded, obviously that's too low for you. And we would have to back off and adjust your medication so that you get into a good control that's not too low for you. So anything that's low, above 90 and between 90 and 120, that's giving you symptoms is considered too low. But if you're not feeling any symptoms and you're having a blood pressure in the 100s, let's say, of systolic, then we continue. That's, good for you. What is resistant hypertension? And that's if you take one diuretic medication, that's, the hydrochlorothiazide, the diazide, chlorthalidone, these medications. And if you're on 3 additional blood pressure medications and you're still having elevated blood pressure and you're taking them regularly as prescribed, that's considered resistant hypertension. And that's when we go into, make sure that your sleep apnea is taken care of, alcohol is limited, hormone imbalance, and your renal artery stenosis, and making sure that, that's not the reason why your blood pressure is not responding to blood pressure medications. And one of the things that we do at Eisenhower is remote patient monitoring program, and especially for our patients that we need to really be closely following their blood pressure. It is a tool that we have whereby, patients are given a monitor and it directly is able to transmit their blood pressure to us. So even if you're seen in office by your doctor every 6 months, every month, your doctor gets a report of your blood pressure recording. So we're actively changing the medication, managing it, and not just, waiting 6 months at a time to make changes. So it definitely comes in handy especially for some of my patients who I really are, I'm trying to really find that really good balance of titrating their medication so they have a really good control. So in summary, hypertension is a silent killer. You may not have symptoms and may have it for years. So knowing your number is critical. Working with a healthcare professional for management is very important, and checking your blood pressure regularly at home and making lifestyle modifications and taking your medication. So this is essentially the tenets, that we follow to make sure that your blood pressure is well managed. So thank you. And you can find additional resources, like I said, on the American Heart Association website. And I am open for questions.
For the audience, please use the microphone. And Brett, do we have anything in the chat room?
Nothing currently in the chat. We can ask people on board if you want to use the mic and ask them as well from there. If they have any questions in the chat, please feel free to put it there. But otherwise, the mic there is on. So if there are any questions.
So doctor, sometimes we see a lot of patients when we're doing our minute heart stuff, and they complain that their blood pressure goes high and it goes low and it's all over the place, kind of a thing, and they're concerned about that. So what do you do with that kind of a situation?
So when the blood pressure is spiking, high and low, typically, my experience has been that they are not on the proper maybe combination of medications to really evenly control their blood pressure. And this is why I make sure that I, get my, patients' recorded blood pressure, and I make sure that they're on the right agent. I make sure that they're on, sometimes, especially with patients who spike all over the place, to get them on even sometimes a twice-a-day regimen, so they have even distribution of the drug within their system in a 24-hour period. So it's very critical. This is why really understanding the pattern instead of just one-time office reading is very helpful. Because there are some patients who spike, but then most of their blood pressure is controlled, and then they really go low when we increase their blood pressure. So in those kind of patients, we allow them, okay, I can allow some spikes as long as your average blood pressure is within a reasonable range. So I allow some of those high numbers because I don't want to overdose them and make them pass out. So that's very important that they record their blood pressure, get a pattern, and then the doctor to engage and make sure that they're on the right medication, the right combination that works for them, and that they're, the bioavailability of the drug is covering them for 24 hours.
Doctor, you mentioned potassium can certainly not cure the amount of sodium you take, but can you have too much potassium?
Yes, you could have too much potassium.
Mhm.
And, usually, for patients with kidney disease is when we tend to run into issues with high potassium levels, because they're not able to clear it because if their kidney function is down.
Mhm.
And in those patients, we make sure that we restrict the amount of potassium that they're consuming. But in the average healthy person with a healthy kidney, you should be able to manage your salt balance, including your potassium balance.
Mhm.
So.
Thank you.
And Dr. Bahiru, what could cause an abnormally low blood pressure?
That's a very good question. So iatrogenic, that would be if you're on medications, if it's on too much medication that could lower your blood pressure. Or, sometimes there are orthostatic, what we call orthostatic, and that's if you don't have the compensatory mechanism to get the blood pressure to, when we stand up, gravity works against us and the blood pressure pulls in, towards the legs. And if we don't have the vascular tone to be able to pump blood up, that sometimes causes patients to have low blood pressure. And so that, works with the autonomic system, the nervous system of the heart. So, and there's other reasons also to have, low blood pressure, but if someone is experiencing low blood pressure, there are certain things that we do, make sure that if it's, medication, if it is something that at the nervous level or the heart level that we systematically go through to make sure, we understand the mechanism.
Great, thank you.
Dehydration is another big one that we see in the patient population that we take care of.
I have a question as far as taking your blood pressure on which arm. Does it make a difference?
Not really. Usually the difference should not be more than about 10 or so, but whatever feels comfortable, it doesn't really matter as long as you're just, what was demonstrated in the video, you're in a position that is, sitting, not crossing your legs, but there isn't any particularly one or the other is right or wrong.
Also, when I go to a doctor's office, the nurse is right there and takes the blood pressure right away.
Mhm.
And I'm like nervous because she's doing all kinds of stuff and asking me questions.
Yeah.
You don't get a chance to just take a breath and relax.
And that's typically why I, emphasize to my patients, I do not respond, at least that's my style of, practice, based on just one blood pressure measurement in the office. And what I typically do when I see the patients after the visit is, almost over, I make sure that I do a manual one. So I have them lay on the exam table. I just use, the manual blood pressure cuff to listen with my stethoscope, do it the old school way, and that would help me correlate with, the machine. And if it's still high, then that means, okay, we got some room to, for improvement. Yeah, no, you should, and some of my, my patients frankly tell me like, I'm nervous. I'm at the doctor's and I feel nervous. I think my blood pressure is high. It's okay at home. And I reassure them and say, this is why I have you check your blood pressure at home and you bring it to your next visit and then we'll respond to it. Okay.
Yes, thank you, doctor, for speaking to our group tonight. Could you comment on the medication Jardian? I do take an ACE inhibitor and a beta blocker, but my doctor suggested I start on that for heart failure. And my blood pressure did go down to 90/48. So I stopped immediately, but
with the Jardian?
With the Jardian.
Yeah.
So he said it was for 3 different things. It was for, it helped your heart and it also helped with the kidney numbers. Not that that's what I was taking it for, but also for your glucose numbers, reduces those too. So since it is such a new medication, I wanted you to comment on it. I
Yeah.
stopped taking it, but
Yeah. And and it's one of the novel therapies, and we've seen incredible gains in terms of reducing cardiovascular complications from for patients with heart failure particularly, and patients with diabetes particularly. And like you said, it's a medication that has been shown in multiple clinical trials to improve your heart function, your kidney, and also diabetes. So it's been one of the drugs that we've been aggressively trying to put, patients on with heart failure. But you're right, one of the functions of the drug is it causes, it has a diuretic effect, and that could make the blood pressure go potentially low, and as it is improving your function as well. And that sometimes patients feel lightheaded or they don't tolerate it. And in that kind of situation, we work with the different medications that you have. We may need to do some rearrangement. And some patients, don't tolerate it. But, for the most part, it is one of the novel therapies that has, come about in the past few years that has really done a tremendous amount of gains in terms of managing
so
heart
would it
failure.
be worth working with my beta blocker or ACE inhibitor, reducing those and continuing on the Jardian? You think
So
it's
that
such a
would be
great drug?
It would be hard for me to say that kind of recommendation because it will all depends what kind of heart failure you have, what kind of, what has been tried, what your current ejection fraction is. So all of that needs to come into play. So probably that's an excellent question when you see your cardiologist. I'm assuming you're being managed by a cardiologist?
Oh, yes.
Okay. Yeah, when you see a cardiologist to have that conversation with them.
Very good. Thank you so
Okay.
much.
All right.
Could you repeat the name of the drug you're referring to? Just so-
Guardians.
Thank you.
Questions? Here, we'll use this. That's right. So soon.
Okay, thank you very much for coming this evening, Doctor. I'm learning a lot, believe it or not. And I wanted to ask similar question to the one the lady asked up there. I always take my blood pressure in both arms. Don't ask me why. I just feel that they should be the same and they're never the same. The diastolic is, higher in my right arm than the left arm, but the systolic, the low one, the diastolic is always the same. It's either 56 or 58.
And the top one is how far apart are the numbers?
It depends what time of the day I take it, but usually it's around in the 120s, which I assume now is high blood pressure, which I didn't think so. And sometimes this one will be 130 and this one will be 120.
So a
Left
10
arm, so I wanted to ask, should I take it in the lower arm or the higher arm?
So the 10-point difference is expected. That sort of is
Okay.
within the standard deviation. The blood pressure is a dynamic thing. It's not something that's fixed. Just because it's 120 right in this arm, a minute later or 2 minutes later, that it's not, if it's 130, that's still within the standard deviation that's acceptable. That is not considered a significant difference.
Should the blood pressure then be higher in the evening? I never thought to take my blood pressure twice a day in the morning and again in the
So
evening.
there are people who spike in the evenings who have what we call nighttime hypertension, and it is actually a mark because blood pressure does go down when you're sleeping and when it's supposed to go down. And there are patients who have elevated blood pressure at night, and that is independently associated with higher risk of cardiovascular disease and events. If you're on a blood pressure medication that let's say you take it in the morning, and then if your nighttime blood pressure is higher, spiking, it's possible that the blood pressure that you're taking may not be enough. That it may not be covering you for the period of time.
Well, I usually have the sense of dizziness or lightheadedness when I get up in the morning, but the rest of the day, not so. Is that just typical of low blood pressure in the morning?
It all depends what your blood pressure is.
Oh,
But
okay.
this is why what I recommend is record your blood pressures in the morning and evening,
I have a
and
book.
you show it to your doctor and have these discussions.
Okay, thank you very
Okay.
much.
Thanks, Polly.
Doctor, I have a question because now all of a sudden I see that anything above 120 systolic is now considered high blood pressure. Yet for years, the 120s were considered normal, and you had to be 130 or above to be considered at the beginning of hypertension.
Yeah, and let me go back to that slide. So it's not considered, so elevated, 120 to 121, 29 is elevated, not necessarily hypertension yet. It's above 130 to 140 range. That's the stage 1 hypertension. But if you're in the 120s, you're on blood pressure medications, we consider that good control.
Thank you.
Questions?
Doctor, I had a question regarding the taking of medication. I take one of the beta blockers you had listed, and I've read that both matters or doesn't with or without food. I take another medication in the morning for a low thyroid, and that is clearly stated, without food or anything. And I'd prefer to take my blood pressure medication at the time for convenience. Is there any studies or thoughts on if it's better to have it with food or not, or is it okay to do that in the morning, take those both together before eating? Yeah.
You can take it before. To be honest, there isn't any strong recommendation. There are some people who like taking their medication before eating. Most of the time, I tell my patients eat it, take it with breakfast, right? Around the time that you're eating breakfast. But there isn't a strict recommendation that it's better if you take it with food or not.
Thank you.
Yeah.
I'm under the strict instruction of taking blood pressure in theory before 10 a.m. and after 6 p.m. If I'm a late riser, which I don't know how many people there are, but in the morning when I'm a late riser, I give myself the option of taking it before breakfast or after breakfast. If I take it after breakfast, is there a timing of going through breakfast digestion before I take the blood pressure? I've always heard that
The
you have
only
to
thing
take
that I
it.
can think of is if you drink caffeine with your breakfast.
Don't
could
drink caffeine.
potentially impact your blood pressure, but generally, and if you take blood pressure medication, I'm assuming if you take it with your food in the morning and you take your blood pressure afterwards, you're gonna see the effect of the blood pressure medication immediately. So whether you eat breakfast or not, what I recommend is taking the blood pressure before you take the medication. So does that make sense?
Take the blood pressure before I take the medication?
The blood pressure medication.
Oh,
yes.
okay. Well,
Yeah.
that's not what I've been doing it afterwards. So it's giving it a false reading, in other words.
It's not necessarily giving you a false reading, but it's giving you the blood pressure immediately after taking, your medication. So I expect your blood pressure to be lower at that time. What would be helpful for your doctor, at least what's helpful for me and what I tell my patients is I want to know what your blood pressure is before you take your morning medication, because that's important information to see like how well you're controlled 24 hours.
So I don't have to pay attention to the digestion.
I maybe something, I don't know if you've read about it. I don't know anything in
Okay.
regards to that.
Okay,
Yeah.
thank you.